Basically, when we look at liposuction, it is suitable for anyone who has completed their physical growth and has no medical issues that would contraindicate general anesthesia or surgery. However, it is certainly not appropriate to describe it to you with such a broad spectrum here. For liposuction, I always say this to my patients, friends and acquaintances, dear viewers. Liposuction. Patients should be at their ideal weight or close to their ideal weight, but regardless of what they try. No matter what sports or diets they do, they should be patients who cannot melt the fat in certain areas of their body. Patients like that. For instance, imagine a woman 5 feet 3 inches tall and she weighs 55 kilos. That is a very healthy weight. You might wonder if she's a candidate for liposuction. Yet, I have seen even thinner patients who have protrusions in the hip area or bulges in the waist area, which we call love handles. Or let us stick with the same example. Consider a lady who is 160 centimeters tall and weighs 65 kilos. For instance, this patient can also, after we identify the examination findings, have her body contoured via liposuction, and we can create major changes. Here, I wanted to explain who we perform liposuction surgery on by giving some examples. On the other hand, I think we should also say the opposite, who should not or cannot have liposuction surgery. Of course, while saying these, I am conveying my own practice, my own experiences, and my own truths to you in quotation marks. Therefore, I would like to specifically state that this is not a statement that would bind our other surgeon colleagues. According to my truths and experiences, I do not perform liposuction on a patient 5 feet 7 inches tall, weighing 120 kilos. Because although liposuction surgery has the ability to slim the patient, even if we do it to a small degree, the primary goal in my clinic, in my mindset and in my philosophy is not weight loss. The main logic and purpose of liposuction surgery should be body contouring. Consequently, for a patient who is morbidly obese, to say that with the liposuction method I can help is, in my opinion, not correct. But do we have no solution for such patients with excess weight? Of course we do. After bringing their weight to a level close to ideal, even if not their ideal weight, in such patients with excess weight, only isolated liposuction, but likely by combining liposuction with skin tightening surgeries, we can assist them. Therefore, after explaining who we will perform liposuction on or who we cannot perform it on, I want to emphasize this again. Liposuction is a body contouring procedure rather than a weight loss surgery. Please make a note of this.